You could tell me start, I will start.
Okay. Hi, everyone. Thank you for attending our virtual dental shadowers session. We want to remind you that in order to get your hours, you will have to take a short quiz. And as long as you get 3 out of 5, you will earn your hours. The quiz link will be located in our link tree, which is in our Instagram bio. All right, let's get started. We are very fortunate to have Dr. Mohini for today's session. I'm handing the mic to you. Feel free to start whenever you want.
Okay. First of all, I would like to thank Virtual Dental Shadowing for giving me the opportunity, and I'm very fortunate enough to talk on this platform. Without undue time wasting anyone's, I'll just start with my presentation. Giving up my brief introduction, I'm Dr. Mohini Daultani, a periodontist, implantologist, and laser specialist from Navi Mumbai, India. So this is what I'll be covering the presentation under following contents: introduction, background, few achievement and awards, and how the typical day is like, periodontology and terminology is used, cases, and take-home message. So to begin with, a brief introduction. I have completed my master's in periodontist and implantologist in year 2016. Also, I hold my fellowship degree in oral implantology and laser dentist. And recently, just last week, I had completed my laser specialty course affiliated by World Clinical Laser Institute, USA. That is called as Associate Fellowship. This is where my college is. I completed both my undergraduate and postgraduate from the same college. I completed my undergraduation in 2012 and post-graduation in 2016 from Krishna Institute of Dental Science, Karad. This institute is pretty close to Pune. That is what I could give a brief idea, because that is a very well-renowned thing you could know. And yes, I should say in 16, I completed my master's. In 17, I was married. And in 2020, I had a baby. So these are very 3 important M of my life, because as a girl, there's a lot of transition of your life and phases during doing your master's, then you get married, and then you're a mother. So things change drastically. But yes, how the things go ahead is what I'm going to show you. Presently, I'm working as a consultant at Apollo Hospital and various private clinics across Navi Mumbai. My basic, I'm very passionate about painting. So a few just about it I'll be putting up. So these are my paintings that I do. These are a few sketches that I do. Now coming up to few community services that I do besides dentistry. Why is this important? Because yes, this adds up like a cherry on your cake to your CV. So it's very important that it's not like you're just doing practicing dentistry, you go to clinic, you do the patient, but doing community services is also very essential. So these are what free dental checkup camps we keep on doing for the underprivileged students. We also give oral hygiene lectures. Right now, because of COVID era, everything was going online. So we had taken a lot of online lectures also for them. Now coming up to few achievements that I have received so far. I am presently a Maharashtra State Media Secretary by IAIDS. I'm also brand ambassador at Dental Reach Digital Magazine. I'm an associate editor of Contemporary Research Journal of Multidisciplinary Sciences. I've published 2 books, that is Fundamental of Lasers in Periodontics and Basics of Laser in Dentistry. I'm very passionate about dead lasers, so that is the reason I was able to write so much about it and publish a book. Also, I was invited as a keynote speaker at Dental Reach Divas Summit 2021 that was held recently. Now coming up to clinical case presentations. This is what I have also presented clinical cases at various conferences and had received prizes. So this was at Global Reach Outreach Medical Health Association, at Dentoscope Academy. Now coming up to the articles publication, this is very, very important when it comes to your CV. just passing out and getting good grades or getting good percentage is not important when you pass out, and what makes you different about the rest of the crowd is your article publication that really adds up to your CV. So during your graduation also you should write articles. We keep more focus on article writing when we are in post graduation, but actually you could start writing in when you're in third year or fourth year of your graduation. That could really add up to your CV. These were the few articles that I have published. Mouthwash as best shield of oral cavity. This is the recent article. I have so far published 6 to 7 articles that are published in PubMed indexed. There is something called as indexing that is very important and that counts in your CV. There are so many indexed, but PubMed is something very higher indexed, and for that your study should be really strong enough to get selected. This was about white fungus right now. Now coming up to online webinars that I've presented, this was at Chase Academy where I had presented online webinars for all the weekends related to all the topics of periodontology. At Dental Udan Academy related to about second wave, its clinical and non-clinical troubles. At KP's Academy about endoperio lesions. I was very fortunate enough to present a presentation at Global Summit that was a webinar, and my topic was gingival depigmentation basic and beyond. So yes, when you do presentations, and it really boosts up your confidence also, and also at the same time that is really something going to add up to your CV and make you something different out of the crowd. There are a few awards that I've received. This is Budding Dentist of the Year. This is considered as a dental Oscar in India. That is by Famdent Excellency in Dentistry in 2019. In 2019, I was also awarded as Emerging Speaker of the Year by Indian Health Professional Awards. And then by Indian Dental Divas Award, I was awarded as Periodontist of the Year. This is Doctor's Excellency Icon Award by Genesis World Records 2020. And this was Doctor's Choice Award. If you people know, that is called as DCA 2020. I was awarded as the top 100 doctors, as also a national winner and city winner. And this is the Periodontist of the Year, Famdent Excellency Award that I just received 2 to 3 months back in 2021. So coming to course conduction, I also conduct my online courses on sutures and suturing technique, about fundamental of flaps, that is basic and beyond. And now coming up to the main theme, how a typical day is like. As you know, like being, it's just not you're just pass out student. Yes, you're pass out, you're married, you're a mother. So yes, I get up in the morning, I have a lot of household work to do. Then I go to my clinic, I do consultations, I have surgeries lined up. Then I have a lot of article writing work that I do. You have also few online webinars that I keep conducting. And last but not the least, yes, you have baby to look after. So this is how your typical day is like, full of busy schedule, but yes, that is what something keeps you going. Now, one of the reasons why I became a periodontist was my love for surgery and implant was never ending. And I really knew in my graduation, I was very clear, I'm very interested in surgery, I'm very interested in implants. So yes, periodontology was the thing that I had to opt for. So by the end of fourth year, I was very clear which field I'm interested and which field I have to opt for. Now coming up to all about periodontology, I would like to discuss smile is a reflection of your affection, success, joy, confidence, kindness, and communication. So it is not only decided by your size and shape of the teeth, but also by your gingival harmony. So your gums, that is your gingiva, is very, very important. Both are in interdisciplinary relationship. So both have to go in harmony to have a healthy dentition. I always quote this is very important. It is gums are considered as a small pink tissues, but can make a very big issue if neglected. So never ever neglect gums. That is a building foundation of your tooth. So what is periodontal disease? Actually, it comprises of group of inflammatory condition of supporting tissues of your teeth. caused by a group of specific microorganisms resulting in progressive destruction of your periodontal ligament and alveolar bone. Now coming up to the terminologies that are widely used in your periodontology subject, coming up to flap. So what is a flap? Flap is a section of gingiva that is surgically separated from the underlying tissues to provide visibility and access to bone and root surface. Coming up to the next terminology, that is scaling. Scaling and root planing, also known as conventional periodontal therapy, is a procedure involving removal of dental plaque and calculus on tooth as well as the root surface. Coming up to frenum, it is a membranous fold. As you could see in this diagram, it is a membranous fold of skin or mucous membrane that supports or restricts the movement of part or the organ. Coming to gingival depigmentation, it is a periodontal plastic procedures whereby the gingival hyperpigmentation is removed by various techniques. Coming to pocket, a periodontal pocket is defined as a pathologically deepening of your gingival sulcus. Recession is considered as exposure of teeth by apical migration of your gingiva. So now coming up to the next terminology, that is furcation. Invasion of bifurcation or trifurcation of multi-rooted teeth invaded by periodontal disease. Coming up to peri-implant mucositis. So as you know, if you have inflammation of gums that is in tooth, that is called as gingivitis. So if you have inflammation of gums around implant, that is termed as peri-implant mucositis. So it will only involve inflammation of your gums. There is no loss of your supporting bone following initial bone remodeling. It is basically a reversible condition if you do an early intervention. Now coming up to peri-implantitis, when you have inflammation of gums and supporting periodontal structures around tooth, that is called as periodontitis. The same way, if you have inflammation of gums along with its supporting periodontal tissues around implant, that is termed as peri-implantitis. So it is inflammation for your gums along with your bone. In this, you will have bleeding on probing, you will have probing depth more than 5 millimeters, you will have suppuration, and that accounts for around 11 to 47% of prevalence rate. So these were all the terminologies that are widely used in your periodontology subjects. So what are the common complaints that I receive in my clinic as a periodontal surgeon? We are basically, patient comes with bleeding and inflamed gums, as you could see in this diagram. Then patient will come with bad breath and loose teeth. Next, patient will come with tongue tie issues or high frenal attachment. Patient will come for the cosmetic purpose, like he'll be saying, I have a black gums and I really want to get that thing treated. Patient will also come to you for yellow teeth discoloration and he will want to have the sparkling white teeth. They will also come to you for the receding gums issues. The patient also come to you and they report for your missing teeth and they want a replacement in form of either prosthesis or implant. So these are the various complaints that you receive as a periodontal surgeon. Now coming up with the cases part. Case 1, it is inflamed and bleeding gums. So this patient reported to me with bleeding gums and inflamed, and he also had bad breath. So on examination, I found that there was deep pocket, bleeding gums were there, plaque and calculus was present. So what I planned was full mouth curettage under anesthesia. So what is main difference between curettage and flap? Flap is an open surgical procedure where your flap is actually separated from your underlying bone. In curettage, you actually have sets of curate that go deep into the sulcus and you remove all the plaque and calculus that is present. So it is a closed technique, whereas your flap is an open technique. So this is how the treatment looks like after curettage. This is pre-operative and post-operative photographs. Inflammation is resolved, the redness has gone, and this is what we have to achieve, that is called as knife edge healthy gingival margin. Now coming up to the next case, that is depigmentation of gums, and we plan to do it with diode laser. You could also do it with scalpel. There are lots of techniques to treat depigmentation. You can go with scalpel, you can go with laser, you can go with chemical methods, you have electrocautery. So these are various methods that you could go for. So the chief complaint was dark gums. And on examination, I found that I had a very thick biotype of the patient. So biotype is also very essential for the evaluation. So we planned to do this technique with diode laser at 980 nanometer. So this is how the post-operative photograph looked like. After removing all the depigmented epithelium, this is what we could see. The depigmentation had gone and there was slight jarring was there. So this is how the photograph looked pre-operative and post-operative. So depigmentation is completely gone and you have natural pink smile around the tooth. Coming up to the next case, that is about missing teeth. Patient complained of missing teeth and he wanted to replace it, and there were the options given and he opted for implants. So he planned for implant placement in 3.6 and 3.7 region. So this is how we had done. We had given incision, there was flap reflection, osteotomy site was prepared, and finally this is what implant was placed, and this is your post-operative RPG. Sutures were placed, and this is second stage surgery that we do, that is called as gingival former, to form a gingival collar around the tooth. Then abutment trial was done, and finally this is the prosthesis placed. This is how it looked like pre-operative and post-operative. Coming up to the next case, that is endoperio lesion. You have a lot of lesions around your tooth. You could also have purely endo lesion, you could have purely perio lesion, and there is something called as endoperio lesion. There could be primary endo, secondary perio, and secondary endo. So this patient had a complaint of pain and swelling in your lower right back tooth region. On examination, we found that there was decayed and deep pockets with forceps. Root canal treatment was done by flap surgery with forceps. That is what we had planned. So whenever you have such kind of endoperio lesions together, the first, whatever it is, whichever lesion it is, the first treatment modality, what you have to opt for is root canal treatment. First, complete the root canal, let the inflammation subside as much it has to be by root canal itself, and then you opt for your periodontal therapy. So this is how it looked like laterally, and this is how it looked like occlusally. So what we did first, we completed the root canal, and this is the healing after endodontic therapy. The swelling was there, but yes, it had reduced. And then what I had planned was open flap debridement with forceps. I did not place any kind of bone graft because patient was not ready for it. We just opened the flap, we curated area, we cleaned it, and sutures were placed. So this is how it looked pre-operative and post-operative. This is lateral view, this is lateral view, this is occlusal view. And finally, the prostheses were placed. Coming up to the last case, that is your peri-implantitis. Patient complained of anesthetic black line that was found around the tooth region. So on examination, we found that there was exposed collar and inadequate attached gingiva. So what we planned is that let us go for laser decontamination and placement of your connective tissue graft. As you could see, we raised a full thickness flap. So when we raised, we could find the collars were exposed. So we did the laser decontamination. This is the outline that we did for harvesting of your connective tissue graft. The connective tissue graft was placed and the flap was sutured. This is your pre-operative and post-operative difference. We could also have opted for bone graft, but as patient was not ready, we tried to do it connective tissue graft and attained a very good kind of biotype, and soft tissue thickness was regained. And you could see the problem was completely resolved. Now coming up to the main advice for dental students that I could see is, I consider 5 keys to success. First, be ambitious, be focused, have a lot of dedication and hard work. And the final key for all this is your consistency. If any of your keys have just a short-term approach, it is not going to succeed. So all this will have your results only if you're consistent. So whatever you do, have consistency, be determined, be focused, and you will surely achieve your goal. So I should say success is like, the iceberg illusion. What you actually see is just the tip of the iceberg, but what actually you go through is, a lot of dedication, hard work, discipline. You may also have a lot of failures, success, and that is how you reach your goal, because you never have straight, smooth road going through. You will always have few hurdles, and that is how you have that happy moment when you actually reach the goal. Now, coming up to for the advice for the future dentist is what I always believe: learn from the dentist in your town. Always check for the Google rated high clinics. Visit those clinics with your professional resume. Connect with other dentists on your social media platform. Present your cases with watermark at social media platform. Join the Indian Dental, whatever, wherever you're staying, you'll have that dental association groups. So always get connected of your branch of or your specialty. Keep upgrading, keep learning, attend conferences and courses. Keep doing extracurricular activities like, article publication, book publication, or webinar presentation. These all are the keys to add, to your CV and make it something go out of the box. And that is how it makes you different from the crowd also. Now, a small and last take-home message for everyone is like, I always believe there are two kind of people. So it is the one person is about finding opportunity in every situation. The other one is the one who will cry in every situation. So successful people are those who will have that all kind of failures they will use as brick to step up. And the one who are unsuccessful, they will carry all the bricks on their head. Always make sure to focus on the solutions and not the problems. Always remember, there is no shortcut to success. Every success story started with a dream. So you have to dream before your dreams come true. Okay? So for that to make your dreams come into reality, you have to believe in yourself. Always make sure, never say I wish, always say I will. So set your success mark. So see your goal, understand the obstacles, create a positive mental picture, clear your mind of self-doubt, embrace the challenge, stay on track, and show the world that you can do it. So this is all the keys for your success. So always remember, failure is not opposite to success. It is considered to be the part of success. So there is just a very small leap of faith that you have to take from failure to success to reach to your goal. Always remember, unlock your potential. Everyone is born with your gift. You have that inner potential, you have that inner quality. So first try to unlock the potential, know what are your inner qualities, focus on that. The first step will be always the hardest, but the later one will be surely shorter and smooth going. And finally, the success will be yours. So as to end, I would like to say, a winner is a dreamer who never gives up. So dream big, stay positive, work hard, and enjoy the journey. These are all my IDs for the social platform. You people, if you have any issue related to dentistry or related to periodontology or implants and laser, you could connect with me on this given IDs, and I would be really happy to help you out in any ways that I could. I'm really thankful to Virtual Dental Shadowing for giving me the opportunity to present the presentation. I would be really happy if I have helped you out in any of the ways. Thank you everyone for your patience hearing.
Okay, so we do have a few questions that some viewers have asked in the Google Live chat, so I'll just ask you them. So the first question is, how did you improve your hand skills?
I improved my hand skills. I was in undergraduation, and as I completed my final year and I stepped into internship, we already had internship started in college, but I had attached to a clinic who was Google, as I've already mentioned, like, check for the Google rated clinics which are high and you have good patient flow. I had started going for the locum purpose to already a dentist in my internship. So that is, internship is something the last year of your final undergraduation. I'd already started that, and he used to do a lot of surgery. So more you get the exposure and more you learn. So this is how I've improved my skills. since then, and that also helped me ahead in my post-graduation. So as you complete your graduation, you're about to complete either in your final year or at your internship, attached to a clinic where you could have a lot of patient flow, so that as many patients he's doing, you will get a lot of exposure and you will improve your surgical skill.
Okay. Did you have any trouble with the amount of blood involved?
I did not had trouble with it. I was very passionate from since the beginning. Yes, there are few people who have a lot of issues with blood, like you cut, there's blood and you have that phobia. But I think if you're passionate about it, that things get slowly resolved with time.
Okay. So a viewer has asked regarding case 4, would a bone graft have helped the procedure, or was it just not necessary?
Bone graft would have really helped up. That is what I had mentioned. We had actually planned for bone graft also, and then laser and tissue graft. But yes, it had come to a cost factor, and that is the reason patient was not ready. So we just planned for connective tissue graft and did it. But bone graft would have really helped up for the case.
Okay. Another viewer has asked, how do you balance work and life?
I balance my work and life being at this position where I have completed my master's, I have completed my being a mother of a child who's just 1.5 years old. The main thing I always believe is like be a lot of positive, have yourself in positive mode and be determined and be focused to your goals, and always make sure where you're staying, keep the people around you happy. Like I belong to a joint family. I'm not staying alone. I just don't have my husband or child. I belong to a family where I have mother-in-law, father-in-law, I have my brother-in-law and everyone. So belonging to a joint family, make sure where you stay, you keep everyone happy. So if they are happy, you are happy, and that actually reflects in your work. And be a lot of determined and dedicated to your goal and be positive. That is how you will surely make the things easier.
Okay. So the next question is, what is your favorite procedure to do?
I'm very much passionate about laser, as you could see in my presentation. So all the procedures that I could perform with laser makes me really very much happy. Let it be, freenectomy with laser, you have gingival depigmentation with laser, you have operectomies with laser, you have that second stage surgery for the implant case. So that makes me very happy. All the procedures done with laser.
Another viewer has asked, is there anything that you struggled with in dental school?
Yes, during dental school, it was not as like I struggled something. I was very much dedicated from day one. So there was nothing that I could not, but yes, I wanted to always learn more and more and more. So I think it's about personal, your attitude, how it is. So that makes you it. I didn't had any personal issues like, in dental school that I could not cope up with. Initially, the one only thing I was a little confused, like as I was very much interested in implants. So I was just having issues for choosing the field, like I should go for perio or implants, prosto, but finally that thing got resolved with time. So I didn't had any difficulty as such during dental school.
Somebody has also asked, during the interview process, how do you convince the interviewer of your determination?
First of all, the person who is taking my interview, but obviously he has to go through my CV. And once he checks my CV, he really comes to know about my personality that I am. As I've shown you that I always keep on doing a lot of online webinars. I also do course conductions. I have written a lot of articles. I've written books, publication. So that adds up to my CV, and that is how it already reflects in my personality. And be very much positive enough whenever you're answering the interviewer, and that is what I could say.
In dental school, what was the hardest class you took?
Hardest?
Yeah.
I could not get your question, doctor.
Oh, what was the hardest class in dental school?
Hardest class, I should say, was the subject related to, I could not remember so far because it's a lot of time ahead, but yeah, there were subjects in prosto that used to have, but that got used to get clear with teachers later. So it was nothing as such hard, but yes, prosto related subjects related to your, jaw relation, recording and all, that was little tough for me to understand. But as you discuss it with teachers, that got resolved with time.
Okay, thank you so much for taking the time to talk to us about your profession. It's truly appreciated, and I know I learned a lot from your presentation. And to our viewers, remember that we will upload the quiz in a while. It will be posted in our Instagram, so just be alert for that. And you can find the link to our quiz in the Instagram bio. And I just want to thank you once again, Dr. Mohini, for talking to us today, and to everyone else, have a great day.
Thank you so much.